Hello everybody, this is Dr. Jaffrey. I'm a board certified gerontologist, and today I would like to speak to you about the differential diagnosis of memory loss. So question number one, did this memory loss occur all of a sudden, or was it gradual, or has been happening over years? And each one has a different diagnosis. So if it's sudden, then you need an immediate workup for things that might be wrong in the blood, such as low or high sodium, thyroid changes. There can be certain vitamin deficiencies, or even um, you know this, infections that might cause a person to appear to have memory loss. So that needs to be checked out, and extensive workup needs to be done. If it is happening over months, weeks to months, then you need to work up for the chronic dementia. Number one thing to rule out is making sure there's no depression, because that can mimic just like dementia. A person with severe depression will have the same symptoms. It's very difficult to differentiate. So when you've ruled out depression, the next step to do is see if a patient has sign of Alzheimer's dementia or the chronic dementias. So the most common signs are loss of ability to do tasks that you were able to easily do before, such as cooking, shopping, finances. So these, when you were able to do these before, and now you're making mistakes. Very commonly, you hear the patient left the stove open, or making incorrect turns while driving, and you're forgetting rules. So that's a very common finding, and that's actually a loss of executive function of the brain. And then there are activities of daily living. This is mostly in advanced dementia, and loss of feeding, ability to shop, dress, toileting. That's activities of daily living. If that's lost, then those are signs of dementia. Now, there are different kinds of dementia, and I've made another video about that. Now, if the dementia is in a younger person, there are like things such as CJD disease. It is something similar to mad cow disease, and that can cause dementia that's in younger people, and that happens usually months, weeks to months. Parkinson's-related dementia is very common, and the treatment for that is different from Alzheimer's. Something called Lewy body dementia, which is characterized by visual hallucinations. So if you have visual hallucinations, that could be Lewy body dementia. And there's another dementia called frontotemporal dementia. This is an extremely interesting kind of dementia where a person's personality completely changes. And the way this was discovered was about 100 years ago. There was this railway worker who used to be a very reliable, smart railway worker. And one day an accident happened, and a piece of the rail went and hit in his and lodged in his frontal part of the brain. And after that accident happened, the person completely changed. His personality was lost. He was no longer reliable. Couldn't do tasks well that he used to do before. And then, then we realized that part of the brain, that's the frontal lobe, is actually where the personality lies. So, in conclusion, basically, the differential diagnosis of memory loss is dementia, delirium, which is a sudden onset of dementia, and depression. Those are the main ones. Okay, if there's any questions, you can put it in the comments, and I'll be happy to answer those for you.